Hey everyone, welcome back to Med with Manny. Today we have a special guest.
Special guest? Wait a minute, this is my channel. You're the special guest.
Right.
And I'm here today to redeem myself because last time we played this game, Kalista beat me, and today I'm gonna beat her. Okay? So, we're playing med, no, we're not playing Med with Manny, we're playing So You Think You're Smarter Than a Med Student. And this time we changed things up a little bit. Questions are gonna be nice, short, and simple, easy to follow. Video is gonna be shorter. And this time, I'm gonna ask Kalista psych questions, and she's gonna ask me med questions. So there's 4 questions. If we tie, let's say we get all 4 right, or we get 3 out of 4, then we've prepared a bonus question, okay? So, let's do it.
So, question 1.
Yeah.
Endocrinology.
Okay.
Which of the following are common symptoms of hyperthyroidism?
Okay.
You have 4. You have to choose 4 of them, okay?
Okay.
Out of 6.
Okay.
Okay?
Okay.
So, A is weight gain.
Yeah.
B is diarrhea.
Yeah.
C is urinary frequency.
Okay.
D is weight loss.
Okay.
E is tremor.
Yeah.
And F is heat intolerance.
Okay.
So 4 common symptoms.
Hyperthyroidism. You're shaky and hyperthyroidism. So tremors was one of the options, right? So that's one of the symptoms.
That's one.
So I'm trying to think, weight gain or weight loss. If your thyroid hormones are over-secreted, then you're promoting metabolism. So it must be associated with weight loss and not weight gain, right? So weight loss. So I have eliminated weight gain. And then the other...
You had heat intolerance, you said?
Heat intolerance. Yeah, I feel like you're intolerant to heat.
So that's number 3?
So your set point is lower than normal. Something like that. I think that makes sense. 3?
So number 3, okay.
3.
And the 4th one?
What are my 2 options left? But hold on, if your metabolism is faster, then you might not have as much time to digest, and so diarrhea would probably make sense.
Okay, so that's your 4.
I'm gonna say those 4.
Okay, so let's repeat.
Yeah.
Your 4 final answers were diarrhea, weight loss, tremor, and heat intolerance.
Yeah.
That's correct.
Yes.
Round 2 is cardiology.
Let's do it.
Okay.
Cardio.
So, what is the most commonly involved coronary artery in myocardial infarction?
I think I know this one.
Okay, let me list up the options.
Okay, let's do it.
Okay, so A is right coronary artery.
Okay.
B is left anterior descending artery. C is left circumflex artery.
Yeah.
And D is posterior descending artery.
Okay. Pretty confident about this one. Okay, because the left coronary artery is much bigger than the right, usually speaking. Depends the person. Okay, but we're talking about general individual. Left is bigger than the right. The right coronary artery is the entire coronary artery, so it includes the subdivisions. But the left side, particularly the left descending, is the one that literally travels right. Okay, this is good. Right down the center of the heart, and that's usually where various myocardial infarctions occur. So I'm going to say whatever option that was, left anterior descending coronary artery.
Left anterior descending artery.
Let's do it.
B?
Yeah.
Was correct.
Yes. Cardio.
Next question. What is the best indicator of prognosis for a melanoma?
Okay.
Okay?
Yeah.
So A is asymmetry.
Okay.
B is color.
Okay.
C is diameter.
Yep.
And D is invasion of the dermis.
Okay. So I know in dermatology, when you're trying to measure when something's carcinogenic or something severe, you do your ABCDEs. You mentioned some of them. What did
asymmetry.
You mention? Asymmetry is A. So if it's circular like a beauty mark, it's probably not carcinogenic. But if it's asymmetric, it can be. Then you mentioned color. If it's uniform, then it's probably not carcinogenic. So if it's one color, if it's multiple different colors, could be carcinogenic.
Diameter.
Okay. Diameter, of course, the bigger, the worse, the worser.
Yeah, and invasion of the dermis.
So that's probably the most predictive value of the prognosis of a disease, because when a skin cancer invades the dermis, which is below the epidermis. So the epidermis is the top surface. The dermis below that, when it invades that, well, then it has access to blood vessels and lymphatics, which means that the cancer can metastasize to other sites. So when we're talking about prognosis here, that's the thing you want to look at.
So your answer is?
D.
D. Correct.
Yay.
Final question.
Final question. Let's get it.
All right. So, which of the following is not a cause of eosinophilia?
Okay.
Okay.
Oh gosh.
So,
okay.
A.
Yeah.
Allergic rhinitis.
Sure. Yeah.
B. Viral infection.
Yep.
C. Parasitic infection.
Yep.
Or D. Drug reaction. Which one is not a cause of eosinophilia?
Okay, so I'm eliminating A and C right away because allergies can cause a hypersensitivity reaction, which can result in eosinophilia, as well as parasitic infections. In fact, eosinophilia is very commonly associated with parasitic infections. Believe that eosinophils, which are types of white blood cells, can combat pathogens. Now, you said viral infection
and drug reaction.
And drug reactions. So drug reaction can present as an allergic response, right? Like if you're allergic to penicillin, then you can get a hypersensitivity, which probably can produce an eosinic response. I'm leaning towards the viral load because viruses behave differently. Our immune system responds differently to viruses. I don't really remember learning anything about eosinophils being relevant to viral infections. So I'm going to go with B, I think it was, for viruses.
B is your final answer?
B is my final answer.
That's correct. Yes. Good job.
Thank you.
You're better at med than psych.
Yes, I am. That's a good thing.
Yes.
All right. So the first topic is brain anatomy. Okay. So Wernicke's area. Okay. Which is the area associated with speech comprehension.
Yeah.
Is located in which brain lobe?
Don't say that.
A is frontal, B is parietal, C is temporal, or D occipital.
Oh, okay. I know it's not occipital.
Where in my brain is speech comprehension?
Is it like fully in a lobe? I feel like it's in between too.
So, because you're bringing that up, you're right. That technically it can fall between two lobes. So if you can get one of them, I'll give it to you.
Parietal or temporal?
Parietal, temporal?
Yeah.
Final answer?
One of them.
Well, that's it. It's mostly associated actually with the back part of the temporal lobe.
Okay.
But it could be in the front part of the parietal lobe, like the part in between the two.
So it's like
usually
technically temporal.
Technically temporal, but because you mentioned that it's found in both, and you said temporal parietal, I'm giving it to you. Okay, question 2. You ready? So this one's on neurodegenerative disorders.
Okay.
From the following types of dementia, which of the following is the second most common? Not first, second.
Because first would be too easy.
No. So A, vascular dementia, B, Alzheimer's disease, C, Lewy body dementia, also known as Parkinson's dementia, and D, frontotemporal dementia.
Okay. Well, Alzheimer's is number 1. That I know for sure.
Okay.
Lewy body's not as common or less common.
Okay.
The second most common would be vascular
Final answer?
dementia. Final answer. Vascular dementia is number 2.
You're correct. Vascular number 2, Lewy number 3, frontotemporal number 4. Question 3, mood disorders.
Okay.
According to the DSM-5, which of the following is not considered a criterion for depression?
Okay.
Is it A, insomnia or hypersomnia? B, impaired concentration or indecisiveness? C, appetite or weight changes? Or D, anxiety?
What was that?
Anxiety. There's an N. Anxiety.
Which is not?
Which is not according to the DSM-5.
Oh, you're pulling that on
I'm
me.
pulling that on you. You did it to me with schizophrenia last time.
Okay. Appetite and weight changes.
Yeah.
That is probably a symptom of depression.
Okay.
Insomnia and hypersomnia, you said?
Yeah.
Okay, that is one test.
Okay.
And then the last two, indecisiveness, you said?
Impaired concentration or indecisiveness.
Because, like, it wouldn't make sense for anxiety to be listed as a symptom of depression, like of major depressive disorder in the DSM.
Okay. After a lot of thought and processing, your final answer is?
My final answer is anxiety is not a symptom of major depressive disorder because anxiety disorder is a disorder on its own. They often co-occur, but it's not in itself a symptom of depression.
You're absolutely right. That's exactly why I put it
to
there.
Trick me.
Yeah, but you knew. Anxiety disorders.
Okay.
Okay, so the fear and avoidance of situations and public places that make an individual feel trapped. So this is the definition.
Okay.
Is called what? So I just gave a definition of something.
The fear of
basically.
Okay.
Okay, the fear and avoidance of situations and public places that make an individual feel trapped. Okay? A. Social anxiety disorder. B. Generalized anxiety disorder. C. Claustrophobia. D. Agoraphobia. Final answer? Right away?
100%
Not social anxiety disorder?
No, social anxiety disorder is fear of like being judged by others. Agoraphobia is fear of public places.
You see, it takes a psych student to not fall for that trap. Good job. Agoraphobia. Good. So,
It's me.
so
I'm kidding, but not really.
okay, so like we both got all the questions right,
Yeah.
which means we have to move on to the
Final round.
comes down to
You
this.
ready?
And you saved the best question for last, didn't you?
Yes.
Mm-hmm.
Okay, we're going back to cardiology for this.
Okay.
Okay?
Yeah.
What are the classic signs of a cardiac tamponade? Okay.
Okay.
A.
Yeah.
Hypotension, muffled heart sounds, increased jugular venous distension.
Okay.
B. Tachycardia, dyspnea, fever.
Yeah.
C. Bradycardia, weakness in arms, diaphoresis.
Okay.
D. Hypertension, palpitations, chest pain.
Okay. I know the answer.
Yeah?
Because what you're referring to is called Beck's triad. And it's something they taught us in medical school. And it's classic. It's a classic triad of cardiac tamponade. And you describe those three symptoms. So a lot of these symptoms can be symptoms of cardiac tamponade. Okay? Which is, by the way, when there's fluid around the pericardium, which is the sac that surrounds and protects your heart. So there's fluid in between the pericardial sac and your heart. And because of that, the heart gets kind of like compressed. And imagine a heart trying to beat against fluid that's trying to squeeze it in. It's kind of like getting a brain hemorrhage, right? But the brain is entrapped in the skull, but this time your heart is entrapped in the pericardium. So it's not pretty. It's A.
Correct.
Yes. Following treatment is correctly paired with their appropriate mental health disorder.
It's correctly.
Correctly. So 3 of them are wrong, 1 of them's right.
Okay.
The first one is for bipolar disorder, and the treatment is lithium, which is apparently a mood stabilizer. Okay?
That's like old. Okay.
B, for anxiety, general anxiety disorder, let's say, you give antipsychotics. C, for depression, major depressive disorder, you give anticonvulsants. Anticonvulsants. Oh God.
Okay, it's not that one.
Do you know what a convulsion is?
Yeah, it's like a seizure.
Yeah, exactly.
Yeah.
Okay. And D, for obsessive compulsive disorder, you give beta blockers.
It's not that It's not a heart problem, that's for sure.
What do you mean? Beta blockers can be used for other stuff too.
Like what? Okay, so the other. Bipolar disorder.
You are correct.
Okay, good.
So I think it is not able to redeem myself, but
Why not? We tied.
but that's it. So like we tied and we got all the questions right, which is awesome.
Good job.
Good job.
It helps
Go
to be
team,
in our own field.
right? So we hope you enjoyed this video. Let us know if you guys got all the questions right, and if you'd like to see a round 3 or best out of 3.
Maybe we can do something that's outside of both our fields.
If you have any suggestions, leave them in the comments down below. If you'd like to see someone else or someone take on Kalista, someone else take on me, whatever, just give us ideas, throw them our way. We like making these videos and we hope you're enjoying them. And this time you're not going to forget the catchphrase,
No.
right? Okay. Ready? And as always, friends, we'll catch you in the next one.